Hi guys, welcome to my channel. Today we are going to discuss direct acting cholinergics. Uh, so we already have started the autonomic nervous system. In the autonomic system, we have studied the cholinergics, introduction of the cholinergics in the previous video, but here we are going to discuss the direct acting cholinergic agonist drugs in detail. So the source of my video is Lippincott. I have chosen this book. I choose this book because of its language is simple and comprehensive, so student can easily understand and memorize the effects or side effects. So let's start the topic. I have prepared some slides of the direct acting cholinergics, so it will help to prepare your short notes and to understand more easily. First of all, they are discussing the direct acting cholinergics introduction. Cholinergic agonists mimic the effects of acetylcholine by binding directly to the cholinereceptors, muscarine or nicotinic. These agents may be broadly classified into two groups. Number one, endogenous choline esters, and number two, naturally occurring alkaloids. I'm going to show you the structures of choline esters, acetylcholine. This is the choline ester and the acetylcholine structure, which includes carbachol and botanicol, and this is the naturally occurring compound, which is the pilocarpine. You can see here this is the acetylcholine, and this is the quaternary ammonium compound, and this is the point where acetylcholinesterase cleave the acetylcholine. So derivative acetylcholine is botanicol, and methane group is attached at the second number carbon. Carbachol where the uh, another amine group attached, so it's the carbamide. That's why it's called the carbachol. And this is a ring structure, which is two rings attached by the methane group. One ring has methane group and one ring has ethyl group. So methyl group and ethyl group, and this is the O and this is the N. So this is all the structure of acetylcholine, and these structures are important for your organic chemistry. But for here, this is for your understanding of the classification of direct acting cholinergics. So all the direct acting cholinergic drugs have longer duration of action than acetylcholine. The more therapeutically useful drugs, pilocarpine and botanicol, preferentially bind to muscarinic receptors and are sometimes referred to as the muscarinic agent. So the important point is pilocarpine and botanicol are receptor specific. That's why they are called the muscarinic agents. So here is the acetylcholine. Acetylcholine is a quaternary ammonium compound that we already have seen in the diagram, that cannot penetrate membrane, although it is the neurotransmitter of the parasympathetic and somatic nerves as well as autonomic ganglia. It lacks therapeutic importance because of its multiplicity of actions leading to diffuse effects and its rapid inactivation by the cholinesterases. So the important point is the acetylcholine is a parasympathetic drug, and but its therapeutic importance is less because of its multiple of actions, or ये inactivate हो जाता है by the presence of the cholinesterases enzyme. Acetylcholine is the receptor non-specific, so it can act on both muscarine and the nicotinic receptors. Its actions include that we already have discussed that acetylcholine belongs to the parasympathetic drug. It's a parasympathomimetic. It means it mimics the effects of the parasympathetic system. And whatever the effects we have studied in the parasympathetic, acetylcholine has similar effects to that. So in the parasympathetic system, the heart rate decrease, the cardiac output decrease. So here the acetylcholine effects shows the heart rate decrease, cardiac output decrease. The action of acetylcholine on the heart mimic the effects of vagal stimulation. For example, if injected IV, Acetylcholine produces a brief decrease in cardiac rate, negative chronotropy, and a stroke volume as a result of a reduction in the rate of firing at the SA node. Normal vagal activity regulates the heart by release of ACH at the SA node. So here the important point is action of acetylcholine on the heart mimic the effects of vagal stimulation. Vagus nerve is the biggest nerve of the nervous system. So this vagal stimulation the vagal involved in the parasympathetic activity. So when the acetyl in the normal whenever the vagal stimulation activates, the heart rate decrease by the release of acetylcholine at the SA node. But in the case when we inject acetylcholine, it produces a decrease in cardiac rate. So there is a definition of the negative chronotropy. So now what is a negative is a decrease in the cardiac rate and stroke volume as a result of reduction in the rate of firing at the SA node. So एसिटाइलकोलिन जो है हार्ट रेट और कार्डियक आउटपुट को डिक्रीज करता है. Number 2, when there is a heart rate decreases, ultimately the decrease in the blood pressure. So injection of acetylcholine causes vasodilation and lowering of the blood pressure by indirect mechanism of action. So वो कहेंगे डायरेक्टली नहीं, वहाँ हार्ट रेट तो वो डायरेक्टली डिक्रीज करता है, ऐसे नोट से वेगल स्टिमुलेशन होती है जिसकी वजह से हार्ट रेट डिक्रीज कर जाता है. बट इन द केस ऑफ डिक्रीजिंग द ब्लड प्रेशर, इट मीन्स इट रिलेटेड टू द vessels. If the vasodilation होगा, the blood pressure decrease. If vasoconstriction होगा, blood pressure increase. So in this case, when acetylcholine is injected, vasodilation occur. Vasodilation occur, there is less pressure on the blood, which produces the less pressure on the walls of the vessels, and ultimately the decrease in blood pressure. What is the mechanism behind this? Acetylcholine activates M3 receptor found in endothelial cells lining the smooth muscle of the blood vessels. So we have studied that smooth muscles contain M3 receptor. Acetylcholine binds to that receptor, and these receptors help in the dilatation of the blood vessels. This results in the production of the nitric oxide from arginine. Nitric oxide then diffuses to the vascular smooth muscle cells to stimulate protein kinase G production, leading to hyperpolarization and smooth muscle relaxation via phosphodiesterase 3 inhibition. In the absence of the administered cholinergic agent, the vascular cholinergic receptors have no non-function because acetylcholine is never released into the blood in significant quantities. So this is the mechanism how the acetylcholine decrease the blood pressure. Atropine blocks these muscarinic receptors and prevent acetylcholine from producing vasodilation. Atropine is a parasympatholytic drug which blocks these receptor and prevents acetylcholine producing vasodilation. So vasodilation occur when the acetylcholine binds to the M3 receptor which are present in the smooth muscles. When it binds, it releases nitric oxide. These nitric oxide diffuse to the vascular smooth muscle cells to stimulate protein kinase G and leading to hyperpolarization and smooth muscles relaxation by phosphodiesterase 3 inhibition. So ultimately when the nitric oxide produced, this nitric oxide is responsible for causing the vasodilation by producing some kind of secondary messengers. So this is the mechanism how the acetylcholine decrease the blood pressure. Other actions include in the GIT, acetylcholine increases salivary secretion and stimulates its intestinal secretion and motility. तो जो आप GIT ट्रैक में अगर देखें, जब गैस्ट्रोइंटेस्टाइनल ट्रैक्ट है, एसिटाइलकोलिन सलाइवरी सिक्रीशन को इंक्रीज करता है. इट्स मीन more saliva produce होगा and stimulates intestinal secretions and motility, जिसकी वजह से आपकी जो digestion है वो increase होगी, intestinal secretion ज़्यादा होगी, motility ज़्यादा होगी. It also enhances bronchiolar secretions. इसके स्लैवरी सिक्रीशंस को भी इंक्रीज करती है, जो आपका स्लावा प्रोड्यूस होता है वो भी ज़्यादा होगा। ब्रोंक्यूलर सिक्रीशंस को भी इंक्रीज करता है। इन द जानेटो यूरिनरी ट्रैक्ट एसिटाइलकोलिन इंक्रीजेस द टोन ऑफ द डेट्रूसर मसल्स कॉजिंग यूरिनेशन ना। अब ये यूरिनेशन कराता है, सो whenever you give the acetylcholine के urination increases because it increases the tone of the detrusor muscle which are present in which controls the urination. So it increases the tone of the detrusor muscle causing urination. So uh, एसिटाइलकोलिन जो है वो स्लाविक सिक्रीशन को भी इंक्रीज करता है। एसिटाइलकोलिन ब्रोंक्यूलर सिक्रीशंस को इंक्रीज करता है। एसिटाइलकोलिन यूरिनेशन कराता है। In the eye, acetylcholine is involved in stimulation of ciliary muscles contraction for near vision and in the constriction of pupillary sphincter muscles causing meiosis, mark constriction of the pupil. Meiosis means कंस्ट्रक्शन ऑफ द प्यूपल। जो आई के अंदर जो एसिटाइलकोलिन है वो मियोसिस कराता है, मतलब प्यूपल की कंस्ट्रक्ट कराता है। इसके अलावा स्टिमुलेशन ऑफ द सिलियरी मसल्स करता है, कॉन्ट्रैक्शन फॉर द नियर विजन एंड द कंस्ट्रक्शन ऑफ द प्यूपिलरी स्फिंक्टर मसल्स। So acetylcholine is responsible for meiosis. These all the effects. It's not a therapeutic consideration of the acetylcholine. We have discovered why it's not therapeutically important because of the multiple actions. Acetylcholine 1% solution is instilled into the interior chamber of the eye to produce meiosis during the ophthalmic surgery. So this is a therapeutic point कि आपको meiosis required होती है, कंस्ट्रक्शन ऑफ pupil required होती है इन द सर्जरी। तो अगर सर्जरी में आपको कंस्ट्रक्शन ऑफ pupil कराना होगा तो you have to give this acetylcholine 1% solution into the interior chamber of eye. These five other actions are also very important. So we have discussed its effect, which includes a decrease in heart rate and cardiac output, and what is the mechanism behind it, because it increases the stimulation of the vagal stimulation ना। vagal stimulation को increase करता है जिसकी वजह से negative conotropic होता है और heart rate decrease करता है। डिक्रीज इन ब्लड प्रेशर और क्या मैकेनिज्म है, ड्यू टू द वेसोडाइलेशन, एंड वेसोडाइलेशन हैपन बाय द रिलीज ऑफ द nitric oxide. This nitric oxide is responsible for dilatation of the dilatation of the vessels um, mm, and by increasing or decreasing the some kind of secondary messengers. And what is the blocker of the cholinergic antagonist? We can say it's atropine, which prevents from producing the vasodilation. तो एट्रोपिन आप दे सकते हो अगर ज़्यादा अमाउंट में स्टेबल क्योंकि ब्लड प्रेशर लो हो रहा है तो एट्रोपिन इसको प्रोहिबिट करेगा। So here is the adverse effects of acetylcholine, which includes sludge. You can learn it by the mnemonic of the sludge. S for salivation, L for lacrimation, U for urination, D for diarrhea, GIT cramps, emesis. Emesis भी हो सकता है। तो sludge is the side effects of or adverse effects of acetylcholine. So I am going to show you in the diagram which is mentioned in the book. You can see here, this is the picture of the diarrhea, then diaphoresis, meiosis, constriction of the pupil, nausea, urinary urgency, urination. See, salivation, lacrimation, urination, GID cramps, emesis. These are the side effects of the or adverse effects of the acetylcholine. And we already have discussed these side effects in the diagram. Here you can see this one: diarrhea, diaphoresis, meiosis, nausea, and urinary urgency. This is all about the acetylcholine. In the next video, we will study botanical and carbachol. If you have any question regarding the direct acting cholinergics and you want any kind of notes and material, you can ask me in the comment. I hope you like my video. Kindly subscribe channel and never forget to click on the bell button. Thank you.